Hi, welcome. It is May 22nd, Friday, and we are meeting briefly because we were just messaged from the Senate, H 817, and changes that they made to that, and Katie's going to walk us through it.
Great. Good afternoon, Katie McLean, Office of Legislative Counsel. It's nice to see all of you. Let me share my screen. Okay, here is a Senate proposal of amendment of 817. To refresh your memory, this is the bill that had the two programmatic pieces, the peer-to-peer program and the mental health literacy program for adults within a school, teachers or other support adults in the school. There was no funding as it left the House for those two programs. And there was a component of the Department of Mental Health providing some guidance for those programs. So what's coming back to you are some legislative intent sections. First, you have language that it's the intent to have these programs that the Department of Mental Health and
Oops, can I stop you real quick? What version are you on?
I'm looking at the Senate proposal of amendment.
Is it the same as what 3.1 or?
One? Yeah, I don't think there are any changes on the floor.
Okay. All right, so
it should be good.
We should be good. Yeah, 3.1 was what went to the floor and now it's like done, so it just changes from the version.
That's 2 pages and what I printed was like 5.
No, that's a different one. But 816, it's different language. This is different language. This is what we got confused.
Yeah.
Yeah, no, we've got.
We're following you.
It's just a different read. And
Are you okay with, if you told us you're okay with that, that's good.
Yeah, I mean, the lead-in language is sort of directing what's happening at the parliamentary level, but the text should be the same. So we're looking at this section 1, legislative intent. And this sort of acknowledges the two programmatic pieces that you discussed in your committee. It says it's the intent of the General Assembly that DMH in collaboration with the AOE oversee these two programmatic components. And let's see, taking effect on July 1, 2028. So it's anticipated, I mean, you'd need legislation to effectuate having these programs take place before July 1, 2028. So this is just acknowledging that there is an intent to have these programmatic pieces running and overseen by DMH by those dates. Then you have some funding language that is part of its fiscal year 28 budget presentation. DMH, in collaboration with AOE, is to explore potential funding sources for the mental health literacy and peer-to-peer programming described in section 1, including whether any existing special funds are appropriate sources of funding, and provide recommendations accordingly. So this is pretty much asking for the administration to come back during the budget process and ask for suggestions on how the programmatic pieces should be funded.
But they could say none
But they still have to come back to us.
and say none.
Yeah.
They would have to
Say something.
Yeah, I know.
Yes.
Section 3. This piece came about, there was some conversation downstairs about what is happening right now in terms of mental health programming in schools. So this is requesting that by January of this coming year, DMH, again in collaboration with AOE and other stakeholders, submit an inventory of existing programming in schools to the policy committees and appropriations committees. The inventory is to include a recommendation on integrating the mental health literacy piece and the peer-to-peer programming discussed in your bill into the existing programming and services listed in the inventory. It's saying what is out there and how do we integrate these two programmatic pieces into what is currently happening. And then you have a July 1, 2026 effective date.
Go ahead, Brian.
Um,
I'm thinking.
I don't remember if there was an inventory in our original bill. No. Do we know what information because it doesn't say year. It just says there'll be an inventory that'll include a recommendation. It doesn't say what the inventory itself will include. do we have any idea of like, is the inventory just gonna say like at Burlington, at Edmonds Middle School in Burlington, there's a peer support program, or is it gonna say at this school, there's this program and this many kids go and this is the things they talk about and this is who runs it and this is how much it costs? Like, do we know what this inventory,
This doesn't, sorry to interrupt you.
it's okay, you're not really interrupting me.
Okay.
You're answering the question before I finish it.
This language doesn't provide specific guidelines as to what information is going to be contained or how detailed it's going to be.
That's what I thought.
And then there might be some issues with aggregation. Like if it's a very small school and X number of students participate, and this is sort of the narrow topic of what they're talking about, I imagine that there might be a need for some higher level data.
I agree.
Go ahead. I think I'm a little bit confused on, so they're gonna do an inventory.
Mm.
But I'm kind of hung up on the inventory should include a recommendation to integrate the mental health literacy and peer-to-peer programming of this act into the existing program and services listed in the inventory. So if like one school is on the inventory, would that school be the only school that would be able to have this literacy and peer-to-peer programming inserted in this?
I don't think so. I don't know that it is necessarily recommending which program pieces should be at specific schools. I think it's looking at the big picture of what types of services in terms of mental health literacy or mental health services generally and programming generally is happening in school. And then where do the two pieces that this committee discussed this year fit into that inventory? And what recommendations are there to integrate those types of programs into what already exists?
So would the inventory include schools who have absolutely no existing?
I don't know that it would even be an inventory by school, like this is offered at this school or this is offered at this school. I imagine it might be higher level than that.
Okay,
These are the types of programs that are offered.
okay. I was hung up on like, if one school shows up on the inventory, that's the only school because it's listed in the inventory that would then get, but it's higher level than that. Yeah, I was thinking granular level. I'm sorry, Val, did you have a question?
It's a shift from a school seeking to implement that to, okay, we're doing a report and this is C, so we're going to just automatically kind of take the next step and just put this into schools. I mean, so the funding was maybe a grant.
We didn't have funding in ours either, but what we did was the concept was to pave an on-ramp so that as funds became available, either state funds or federal funds, or nonprofit grant funds, entities that have these kind of programs could work with local schools to implement them, but it would be under the guidance of DMH. So DMH would have to, per our original bill, be developing appropriate guidance by age, et cetera. So this doesn't include any of that, either any sort of on-ramp or any sort of umbrella for DMH to develop guidance for doing peer-to-peer programs in schools. Those pieces are out. This is just an inventory of where are we right now with these programs, where are they in our state and who's doing them.
Does this keep us on the path we were going in the original bill?
Everyone's looking at me. I really want to hear from other folks.
I feel it's, they're like, okay, who's interested? That's maybe what the inventory is. And how can we feed off of that? Is that like how they're?
I think they're
evolving?
wondering who's doing what.
Yeah.
Katie, correct me if I'm wrong, but I think it's more of who's doing what, because I remember having the conversation with them downstairs, and we had a debate here where we remember testimony from Mentor Vermont, Vermont After Schools. And we were looking at all the different types of places that we can really impact with youth with these programs. And so I think what they did is they built off of that idea and said, before we start, tasking DMH with developing guidelines and whatnot, let's take a scan of who's doing what. I think what's not in the Senate bill is just that piece. Like there's no, we had gone into a lot of detail about DMH providing oversight and guidance if a school requests these things, if funding becomes available.
I know we had a great deal of talk about school and after-school programs in section 3. The inventory only includes services in school. Not after school as well, even though it's after school in section 1.
Yeah, section 1 had after schools. Yeah, I think
Section 1, they pulled language from your bill. So a lot of the language describing what is involved in each program, we just pulled it directly from your draft, which is why after school is included there. And then they came up with section 3 from scratch. They weren't pulling from language you had already created.
I mean, I think that, sorry.
So is the inventory new? Yeah. So even though I wasn't here for the original bill, I'll still jump in. One of the things I found though is that programs are siloed. So, I may not know what Val's doing, who may not know. So an inventory to me, you guys may want to go further than this, but I think an inventory is a pretty good idea.
I agree.
I totally agree.
Yep.
I absolutely agree. I'm just wondering if again, I'm kind of getting hung up on this last sentence. That
Yeah.
that if they do come up with something and they're making recommendations to integrate something like this into an existing program that is listed in the inventory. So therefore, if after schools are not in the inventory, how would after school programs be able to take advantage of perhaps integrating some of this into their after school program? I'm sorry, Brian, keep going. I'm
Yeah.
like trying to wrap my brain in.
I don't take it as implying in any way that the only sites that are gonna have mental health and literacy programming are gonna be existing ones. I take it as an assessment of what is already happening, so we don't duplicate things, so that we support the good work. I would hope also so that they step in if there's something out of line, because there may be things out there that are not the best things happening that they discover and they say, this is a questionable practice in this school district in terms of mental health. How do we support the staff in correcting that so that the kids are getting proper treatment? So I see it as both building on this, as having the potential to build on existing assets and strengths in local communities, while also identifying gaps in areas where there needs to be extra support or help, but it's not clear. So I'm saying this because this is like what I'm hoping it means, but it's not clear. And if there was time to fix this, I would support a conference committee or an amendment because it would be good. But I will still vote yes on it. It's not a deal breaker, but I just feel like the lack of clarity means we could get back something really good, or we can get back something really weak. Like 5 schools have an after-school program. And we recommend that all schools have one, and that's all it says. Like it'd be great if they were like, some of the strengths of the Vermont system of care are these models that we see in a variety in 7 school districts, and these models in 16, and these in 5. And we learn that 48 school districts have nothing. And here's our plan to give them something. That's what I would like here.
But that would tell us something too.
Yeah.
But
That's way beyond inventory.
I share the concern about the lack of detail and also agree that they've improved, like having an inventory is necessary before we start doing anything. However, I think it sort of flips the approach of our original bill, which was driven by demand from the schools
Yeah.
and the kids. It's not the state saying, here's what's happening and here's where the gaps are. Because I don't remember the last time this Department of Mental Health came to us and said, here's an opportunity to help kids in schools with mental health supports. I think we need to let the schools come to us or the youth come to us, like they showed up uninvited. The kids came out of the woodwork for this bill.
I will say, I am not sure there is time. And I like January 15th of 2027. They gotta come back, at least with the inventory. And if at that point, you need to put much more directive, we can before 2028.
Also, people monitor this, so the
Yeah.
conversation will be watched.
Yep.
And I have faith that DMH will hear this and be like, okay, now we know what they're looking for, you know? And to your point, Daisy, I want the youth to be empowered I want them to be empowered to articulate what they need. One of my concerns, though, is that so many youth are disempowered currently by the system and don't even think they could contact a legislator or don't even think they can ask for help. So it would also be good if, I am curious with their I'm curious to hear their recommendations, but I hope that we can also be like, how do we invite the kids in? Because not every kid's gonna think I should ask, but if there was a way, like imagine if there was like a campaign in every school in the state, like, what do you need? Scan this code, and then kids were like, I know you don't want kids to have phones in schools, but you get my point. You get my point. Or the parents get something that they sit with their kid at home and they say, hey, let's fill out this thing together. You know, and then they submit it. Like, if there was some way to invite the kids in, that's all. So I think that recommendations are good. But I think having like no invitation that not every kid, I guess, is gonna think to advocate like those kids did. I guess that I just want to make that point.
Not FYI, NAMI now has a youth advocacy program where they're connecting kids with folks like us specifically around mental health advocacy. Yeah.
I like the fact that we're moving something forward. We're like taking a step. And I'm just thinking about the fact that we have to do a grant proposal every year for the Rural Health Transformation Grant funding. And that maybe by passing this and getting it on the radar, that maybe DMH might put forward funds or a proposal in RHT.
There is dedicated money for mental health and substance use programs, separate from the RHTP money out there right now, that this would be eligible for.
Federal grants?
Yep. Not with an inventory.
Anyone have any? Like, there's a couple things that I would change in it, but I don't want it to die.
Yeah.
I don't think you should let the word inventory scare us.
It
I'm not
doesn't.
Data,
Yeah.
Oh, no, I like it, the
Yeah.
inventory.
so I don't, if it's there, there will be information that we could probably use. I'm okay with that.
I think it's a good.
I'm okay with that as long as people don't let the word taxes scare them.
You know, need some peer support.
I think it moves us forward. Yes,
I just want to ask you one question.
yeah, of course.
So I'm assuming this wasn't discussed in the Senate, that the fact that there was a inconsistency between the language in section or section 3.
Meaning that one of them omits.
Yeah.
after school.
Because it's really like we were thinking after school, we were thinking summer programs, we we're thinking where the kids are. when they might need-
I don't necessarily remember a specific conversation around after school with regard to section 3.
Also, the inventory shall include recommendations, blah, 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 described in section 1, so it kind of refers back to
Yeah,
section 1
that's
there,
good.
and that would include the after school. Plus, I think if anybody scans the nonprofits in the state that are doing this work, they're gonna see that after school has a big foot in that space.
Yeah, and we heard from. a couple of them, yeah. I remember Katie had a whole bunch of yellows for everywhere there was school, then it was after school. Well, if there's not any more discussion, then I'm gonna take a poll on whether or not we concur with the Senate proposal, or no, that's gonna, it's right well. All those in favor of concurring? 10-0. Not gonna ask, it doesn't.
I was saying aye.
Oh. Is that what that was? So I think this is coming to the floor this afternoon. Fast and furious.
Mr. Vito, we have to go back.
Alive.